it looks like we've got a pretty good mix of people from all over. Thanks for joining. Awesome. So we'll just get started. My name is Amelia. I am the communications director for Green Mountain Patients Alliance. I'm also a founder. We have kind of put this together to talk about the new medical use endorsement retail license that was in some bill language that was passed during the last legislative session. And this is a license that is going to allow adult use retailers to sell higher potency products to patients or all products tax-free, which is a really big deal. That's gonna help with access and affordability for patients all over the state, and hopefully will encourage some people to join the program because the legislature is much more willing to make change when they see that more people want to be a part of the program and have actually signed up. So anything we can do to incentivize that is awesome. We're going to start with some introductions. I already introduced myself, so I'm going to shoot it over to Jessie Lynn.
Hi, thanks everyone for being here. My name's Jessie Lynn. I am the co-founder with Amelia and Jeff of the Green Mountain Patients Alliance, also the founder of the Vermont Cannabis Nurses Association. I'm a registered nurse and a massage therapist, usually focusing on opioid use disorder, chronic pain, and more recently working with the geriatric population, mostly because they are the #1 age group coming to cannabis. I formerly worked as a UVM research nurse on cannabis and opioids and was lucky enough to publish some of my research with Raphael Meshulam overseas a couple years ago. I'm a trained sommelier, also a bud tender trainer for the CCB, and formerly a tier 2 cultivator outdoor, as well as a cannabis patient myself and a caregiver for my son. So thanks for being here. I'll pass it off to Miss Amy.
Thanks, Jessie Lynn. Hi, I'm Amy Lems. I founded Vermont Cannabis Apothecary, manufacturer tier 2, mostly edibles. I'm a medical patient, and like Jessie Lynn and Amelia, we share diagnoses and found help in the cannabis plant. And I'm a big advocate of the plant across the board, not just for its cannabinoids. And I'm looking forward to working with everybody. And I'll pass it off to Eddie.
Thank you, Amy. Hi, I'm Eddie Fursey, owner of Winooski Organics, a licensed retailer here in Vermont. I'm also the board of directors on Vermont Growers Association, and I'm here to offer some insight from the retailer perspective of this new license and all the things that come along with it. Thanks for being here tonight. Pass it back to Amelia.
Awesome, possum. Thank you guys for coming on and doing this with us. I'm really excited about the changes that are coming. First of all, we're just going to do a quick little overview of the history of the medical program for people who might not be aware. So I'm going to circle way back to 20 years ago now, which is insane. May 20th, 2004, Governor Douglas allows S-76 to become law without his signature, and this bill legalized possession of up to 2 ounces of cannabis and or the cultivation of up to 3 cannabis plants, 1 mature plant, 2 immature plants for patients, only patients suffering from cancer, HIV, AIDS, and or multiple sclerosis. Patients and caregivers had to be registered with the Department of Public Safety, and their cannabis had to be stored in a secure indoor facility. Department of Public Safety would then proceed to watch over the cannabis program all the way up until the CCB took root. In 2007, Governor Douglas allowed S7 to become law without his signature. That allowed for patients with chronic debilitating conditions and not just life-threatening diseases to use cannabis legally under the advice of their physician. That also increased the number of plants that patients could legally cultivate under state law, and that became the 2 mature, 7 immature that we had up until last year. And that also reduced the annual fee associated with the state's medical cannabis patient registry. In 2011, Governor Shumlin allowed S-17 to become law, which permitted the establishment of 4 state-licensed medical cannabis dispensaries and an oversight committee. As approved, each dispensary would be licensed by the State Department of Public Safety, and they'd be permitted to serve up to 1,000 registered patients. In May of 2014, Governor Shumlin allowed S247 to remove the 1,000 patient cap for individual dispensaries, and it also allowed for dispensaries to deliver. It increased from 2 to 4 the number of ounces that a dispensary could have on hand per patient. And it changed the financial audit requirement for dispensaries from annually to every other year. It also removed the doctor-patient relationship requirement for people with a terminal illness. So if you were immediately dying of cancer, you didn't have to wait to have a 3-month-long relationship with your oncologist before they could give you cannabis. And it also defined a medical professional to include naturopaths and nurse practitioners, and removed a prohibition against granting access to medical cannabis to people convicted of drug-related crimes. Fast forwarding a little bit, June 7th, 2021, Governor Scott allowed S25 to become law with his signature. This transferred the medical cannabis program from the Department of Safety to the now formed Cannabis Control Board, and it repealed the Cannabis for Symptom Relief Oversight Committee. Now, this was the oversight committee mentioned earlier. This committee didn't really have any sort of like regulatory power. They didn't have decision-making power, anything like that. What it was a group of individuals who were appointed by various bodies. You had a patient from each medical dispensary, you had a doctor, you had a nurse practitioner, you had somebody from the Department of Public Safety, and I believe somebody from zoning, believe it or not. It was the most random appointment. But really all this oversight committee did was gather patient complaints through the year. They met once a year, they made a report, and they delivered that report to the legislature. That was the whole existence. So this board sunsetted, or this committee sunsetted, once the Cannabis Control Board came into power in 2021. In 2023, Governor Scott allowed H270 to become law without his signature. H270 added post-traumatic stress disorder as an eligible condition for the medical cannabis program. It increased the registration for patients from 1 to 3 years, except for patients with chronic pain. And it also allowed for caregivers to care for up to 2 patients instead of just 1. It increased the plant count for patients and caregivers to 6 mature plants and 12 immature plants, created a working group tasked with determining where the administration of conditions for the medical cannabis program should be located, and to provide recommendations for improving the program. What that did was created, the legislature mandated that the Cannabis Control Board needs to conduct sort of this report about the medical program. And specifically right now, it's ways that medical cannabis is communicated, the use of cannabis is communicated between healthcare providers and patients and bud tenders and patients. And we have been working with the CCB to kind of figure all of that out in a report group, which has been really fun. And then moving forward a little bit more to this year in June, Governor Scott allowed 612 to become law without his signature. And that introduced this medical use endorsement retail license, which was a recommendation from the H270 Medical Cannabis Working Group from 2023. And that added ulcerative colitis as an eligible condition for the medical cannabis program. It expanded the 3-year registration to all patients, including those with chronic pain, and it decreased the license fee for the medical dispensaries from $25,000 to $5,000. I think that brings us up to where we're at tonight, which is we're talking about this medical use endorsement retail license. And this is kind of still a concept that we're putting together. So the CCB has put this language into law with sort of a skeletal framework that they're going to need to go in, and they're going to have to fill with things like regulations. What we know so far is that the medical use endorsement will be available to adult use retailers. It's going to give them some of the regulatory benefits of a medical dispensary, things that are optional like delivery, curbside pickup, tax-free sales, and more. So Jess, do you kind of want to go through this as well? You're muted though.
The guide to Act 66, Amelia?
Act 166, yeah.
166, yes, yes, absolutely. And everyone, you can also jump on the link if they'd like to for GMPA. We do have a guide to Act 166 listed. I don't know if Jeff, you could throw that link in there. So what it says is, since the start of the adult use market, each legislative session, the CCB works with lawmakers, as we know, to introduce legislation that represents the agency priorities. And that was Bill H612 this year. And that was the miscellaneous cannabis amendment with Representative McCarty and Matthew Byron, the chair and vice chair of the House Committee on Government Operations and Military Affairs. It had over 18 sections, and there was significant changes to the medical program. Again, Scott did not sign the bill, but let it go into law in June. The quick facts and the basics, and we'd love to open this up for comments as well. So after I read some of this, we'll see if anyone has any questions or comments. Bill H612, now Act 166. Allows state registered patients to renew their card every 3 years instead of annually. We added ulcerative colitis as an eligible condition for the Vermont Medical Cannabis Program, though GMPA did advocate for all IBS, irritable bowel syndrome, and diseases rather than just adding another one because there are multiple. There's the new MUE, which we'll get into a little more details and hopefully open up some discussion there. And state registered patients will hopefully be able to access adult use retailers instead of only have the option for the medical dispensaries, including not paying taxes and being able to get those higher dosed products, as well as having some other things in place if the adult use dispensary can support that, such as delivery or curbside or even drive-through to pick up products. So those are the basics. And as I mentioned, we'd love to dive into them a little bit more and hear people's thoughts and questions on that as well.
Totally. As we go through the sections of the language of the bill, you know, as it pertains to us and this MUE, we look at, you know, first up is the prohibited products, which we just talked about. That's going to be your higher THC solid concentrates in jars. That's going to be higher dosed edibles, specialty products, things like suppositories and transdermal patches. All of the products that we currently see available to patients through the medical market will be available through the adult use market tax-free. And hopefully that will also allow a greater range of manufacturers into this sort of medical product space as well, because there are a lot of really talented adult use manufacturers who could make some very high quality, high potency products for patients. And that market just has been pretty limited up until now. So the new retailer license is going to go into effect on July 1st, 2025. Before it does, the CCB has to develop rules for this license. That's going to include the protection of private patient privacy, that's a hard one, and confidential records, enhanced training and educational requirements for employees who interact with patients, and the segregation of cannabis products that are otherwise prohibited for sale to non-medical customers. You know, this is going to be a transition for any retailer that wants to take it on. And Eddie, I think you could probably speak more to what this sort of change would look like from a retailer perspective and how difficult something like this would be, or how easy it would be to kind of work around in order to get this license.
Yep. Definitely. You know, first glance and when I first heard about it, you know, I was all on board. I thought it was a great idea anyway to get better care, more care to patients out there. I'm all for, you know, that's kind of why I got into this space to begin with. Just being able to help patients is amazing. And I've seen a lot of patients disgruntled with the medical program, really disgruntled. They, you know, were limited to certain stores, and they ended up finding themselves shopping at rec stores instead and having to pay a little bit more, or maybe not the exact product that they're used to that helps their specific condition. And I think we see the evidence of people dropping out of the med program and dropping their cards and not renewing them. And I think that this program for patients is going to spark something under there again, and hopefully bring. I know a lot of our patients that have let their cards expire would love to get their card back if it came with benefits, especially being able to shop at the store that they're comfortable at, like ours, and be able to get the products that they need, and pay affordable prices, because it really, like, we would still be giving discounts to med patients even if they weren't paying tax. Right now we're giving discounts to med patients and they still have to pay 20% tax, just because there's no way around that. But we're hoping that with this type of program we'll be able to not charge them tax and still give them that 20% discount. So more affordable medicine, more access to the program, is I think really important. So as a retailer, I support it, and I'm hoping that it's going to be something that's accessible for us to get into and get our patients into. You know, I know it will be easy for us to track it all, and and be able to store separated products and make sure they don't end up in the right hands, limit them to certain customers. I think that's all attainable goals that wouldn't cost too much, for a retailer to get into. So, yeah,
And
I
Ed,
think,
specifically speaking to a few of the mandates that you're going to have, how do you feel about your point of sale system already being set up for that confidentiality? Because from retailers that I've talked to and understanding POS systems, it seems like you're already doing that. You're already keeping people's information private, and it's really just training your staff to understand the difference with HIPAA and having those discussions even among staff themselves. But it seems like you're in a pretty good spot and position to be ready to do this anytime.
yeah, definitely. I mean, we're already categorizing our customers by medical patients, and we know who, has a card and who doesn't, and who needs one, and who should have one and doesn't have one. We've heard all the stories, and we our point of sale keeps everything anonymous, in in the transactional data. We do allow customers to opt in to save their data so that they can get loyalty points and stuff like that, but that it's illegal for us to share that stuff. We would never compromise that. So there's definitely a lot of trust there, that you have to build with your customer, so that they can trust you in the anonymous aspect of it. I think that you hit on something that I think is going to be the hardest, and that is, those HIPAA laws, and training bud tenders to skirt conversations or send them to the right place that there's to get the answers that they're looking for. We do deal with that on a daily basis at the shop as is. Because we are serving so many people that would be in the medical program if they could, and if it was more accessible, and you know our bud tenders are already having to have that training where how to talk to somebody like that. And I think that will be the most important, and probably the most work for us on our end, is just making sure that is all. We don't want to be giving out information we shouldn't be, and then what's the liability around that. There is still a lot of questions just how it's going to roll out. So I'm optimistic for sure. And I think our systems are there to make it easy if we want to do it.
And one thing Chair Pepper has talked about, but they have not put into rules, so we'll have to see how they shake it out moving forward, is whether you need to have space for that patient to have that conversation privately. So I know some dispensaries might struggle a little bit with that based on size of the retail location, but that is a discussion that has happened, but we don't know exactly how that's going to play out moving forward.
Yeah, the privacy in that, if they want consultations, I think it's really hard to put that on a rec dispensary. I think there are some that are capable of implementing that, whether if they have the space and they can work with people that are trained to be able to have those type of consultations. But just having a normal bud tender doing that, I don't think that's realistic. Um, but there are certain aspects of privacy that a small shop could do, whether it's just curbside pickup, so
Mm-hmm.
that those people don't have to be seen in the shop, or there's a lot of reasons why someone might not want to be seen on the floor, or talk about anything on the floor.
Mm-hmm.
And I think we'll have to be able to respect that. Mhm.
Mm-hmm. And Ed, you just kind of mentioned one of the other topics that they're also mandating is some kind of formal enhanced education. So do you have any thoughts around that, or does VGA or any other retailers?
Yeah, I mean, we support it. We need it. I know you do a great job with the education you put out, and we've sent a ton of our bud tenders, almost all of them, to you. So I think a service like that, hotlines, I think those were great ideas, and I'd love to see something come back in that aspect, and just more resources for the bud tenders, and for the retailers to point patients to, is super important. And the
I'd love to
education,
hear from bud tenders too, if there's any bud tenders here today. Are your bud tenders, Ed, are they excited about this? Are they nervous about this and feeling overwhelmed? I think they're going to be the ones that are face to face with all our vulnerable and, amazing patients. And I think they're key to all this.
yeah, and there might be some here in attendance right now if they want to raise their hand and talk to it. But I think that ultimately, um, they're the ones on the ground, they're the one talking to these patients every day that come in and say, like, oh, I'm dealing with this, or oh, I just got this diagnosis, or I just came here straight from the hospital. So the bud tenders want to help, the most out of anyone, especially, our bartenders at Winooski. I could speak for them. They care about the patient, and they care about their customers. Even the rec ones, are somewhat using it as some sort of enhancement or help in their life. So I think the bud tenders are excited to be helping these people. I think they're in our store anyway, so they are helping them now, so that this our bud tenders have a relationship with the people that would be part of this program already. um
Hi, Ada, that's awesome that your staff is excited as well. Thanks for coming. So I do want to move on to the next section of the language, which talks about the medical use endorsement fee. This is going to be kind of we'll get into it. So this section creates a new annual licensing fee of $10,250 for the MUE retailer license type. So that's just going to be an extra 250 added on to your $10,000 annual license. We have advocated for this new license fee to be less than a retailer license fee to help incentivize retailers to participate in the medical cannabis community and to support local patients and caregivers. Really what we want to see is incentive for retailers to want to get this. And we had gone back and forth with the CCB on different ideas of how we can incentivize retailers. And one of our ideas was, a first year discounted retailer license. But that was just one. Obviously would love to hear your thoughts there as well. It is worth noting that I believe the medical dispensary's license is only 10,000. They don't have to pay. It's 5,000 now, you're correct. So we also advocated either bringing that up to 10,000 to meet the adult use retail medical use endorsement license, or for that first year, bringing the adult use licensee who is attaching a medical use endorsement down to the 5,000 to meet where that is. Either way, it needs to balance out to be fair. especially when you think about the fact that the medical dispensaries are vertically integrated. And we've dropped their license fee down to $5,000.
And have out-of-state or out-of-country investors.
Yeah, it's these are multi-million-dollar organizations that parent these companies. Moving down, so section 7 was again this ulcerative colitis addition to the symptoms and conditions list. It is always worth celebrating when a new condition is added. However, this has kind of become a very antiquated foot dragging method of attaching conditions to this list, where every year a patient comes forward. This year it happened to be a legislator. Comes forward, they say, I use cannabis for my medical condition and I want to add it to the list. And they beg the legislature, and the legislature either does or does not add it. We've seen a lot of years where they just don't add anything new at all. And so us getting one this year is still good. But ulcerative colitis was added. Crohn's disease was already on the list. There are a few more diseases within the group of IBD, which is irritable bowel diseases. And they all share almost identical symptoms. So what GMPA has been advocating for the last couple of years as well is to move our list into more of a symptom-centered list rather than condition-centered, because all of these conditions share similar symptoms, and people are using cannabis to treat, to relieve the same symptoms of the same condition, of different conditions. So if we had, for example, gastrointestinal inflammation as a symptom, because we know that's what people are using cannabis to treat within IBD, then all of these different diseases will just automatically qualify. So expanding our symptoms rather than just individually expanding condition after condition would be a fairly simple way to greatly increase access to the list. Right now, the last statistic that they showed, 3/4 of our patients are currently registered under the symptom of chronic pain. We don't have the individual data of how many of those people are only there under chronic pain because their condition is not currently listed, but we can surmise that it is a fair amount of them, because chronic pain doesn't just center out of nowhere. It is often attached to a broader condition.
And you, Amy, and I are examples of that, having genetic disorders that don't fall under a verifiable condition, but fall under chronic pain.
Yeah,
exactly. And all of us have several different diagnoses. And so I imagine many other people do. And so it's the combination of those things and going the symptomology route as opposed to, what you were diagnosed with makes absolute sense.
Yeah. Yeah. And I think, if we have chronic pain as a symptom, all of these other quote unquote symptoms are just targeted chronic pain in different areas of the body. So, if we're talking about like an area where inflammation centers, like you're talking about a point of pain. So if we add various points of inflammation, if we add various things that can actually be imaged and shown and proven, then I don't see why that as an example of pain should not qualify you for a card.
And I think it's important to note, most likely everyone on this call knows this already, but to reiterate, we don't have all the research that we want to prove cannabis does or does not work for certain diseases and conditions because of the federal one, illegal status of cannabis limiting the research we're able to do. So we don't have the ability to throw in new diseases easily, but that symptomatology is the answer to that right now. When you look at the mental health field, this is where they're moving. Let's treat the symptoms, not the diagnosis, because the diagnosis can be comorbid or mixed. One doctor is going to give you a different diagnosis than another. So really focusing on these symptoms is what people do when you don't look at the research and you look at the anecdotal patient verbiage and literature. And that's what we're trying to have them at least start to understand and look at, but that will continue to be a challenge.
Totally. Kind of moving through the language, we get down to section 9, which was the medical dispensary fee reduction. So this is what took the medical dispensaries from $10,000 a year to $5,000. And the one-time application fee for a medical dispensary is now $1,000 instead of $2,500. the thought behind this from the CCB's perspective is that they would like to, I suppose, encourage more people who want to open medical dispensaries the ability to do so. I personally have not seen a lot of interest. If somebody wants to open a retailer, the people I've spoken to want to open adult use retail shops because they know that, they'll be able to make their profit back a lot better when the entire adult use population is their customer base rather than 3,000 patients. So that was the thought behind lowering these fees, is that, this makes it available if anybody wants to open a medical designated only dispensary. Again, I don't see a lot of interest there. I'm not sure if you guys have seen a lot of interest there, but I think that it is much more likely that somebody opens an adult use store and attaches this medical use endorsement to it, to reach that population.
Yeah,
Section-
thank you, Myra. Myra writes that, how about if your doctor deems medical cannabis beneficial, then they can issue you a card instead of having to list every condition. The government really needs to stop dictating what care we can and cannot receive. And what a day to say that, Myra. So thank you for sharing that. Absolutely. I think we all completely agree with you and would love to see that be the end result, and that maybe will be, but it's not going to happen quickly and without a lot of advocacy and speaking up. So we appreciate your thoughts and would, love to work with you and hear your voice more and have everybody continue to advocate for this. I think that is the way to go.
And Myra, I
I
think
will also note, though, I think it's important to know that when S54 in the adult use market was approved and became law, that there was one change that happened. Prior to that, doctors were protected legally from being charged or investigated for verifying medical cannabis cards. Since S54 has passed, doctors no longer have that protection. So what we're seeing is doctors who don't want to verify a condition, let alone prescribe or recommend cannabis. And we have, people talking about needing to see 4 or 5 doctors before they can find someone that will give them a card. So we're also starting to talk about mandating doctors to verify the condition or the symptom, not giving them the option not to sign it. And that's also, going to be quite the work in progress, but recognizing that medical professionals are scared at times to risk their license because we removed a protection that was absolutely necessary. So we're kind of fighting a few battles at once.
Yeah, and I mean, that's an excellent point, Myra. Why don't we just leave it up to these medical professionals? But unfortunately, what we also come up against is doctors do not have a very progressive level of cannabis education that is mandated within medical schools right now. And, a lot of the cannabis education that doctors receive or healthcare professionals receive is sort of outdated information. And it very, very little does it center on the patient experience. It centers very much on the science, which is important, but I think that lived experience is also important. And so oftentimes when a patient goes to a doctor who maybe has this inherent bias against cannabis because of what they've been taught, or because of the federal scheduling nature of cannabis, oftentimes you'll see people whose doctors don't even want to talk to them about medical cards. They don't want to talk to them about cannabis. And a lot of the time they'll just want to pass the buck off to like a specialist, for instance. So I do wish that we could just let our doctors make these decisions with us. But unfortunately, until we reach a place where we've rescheduled and education standards have gone up, I just don't think that that's going to be feasible for everybody. I think it might be a good thing to add into an existing symptoms and conditions list that could be verified somehow, but we definitely can't rely on that in this day and age, unfortunately.
And doctors work for businesses. Hospitals, medical centers are businesses, and they're not making any money off cannabis. So typically they have a policy that prohibits their employees, their doctors, from discussing it.
Yeah, absolutely. It's hard. It's very hard to it's hard to talk to a lot of different professionals about cannabis, whether it be in the legislature or in your own doctor's office. It's crazy how much of how much of a stir this little plant causes. Really.
But I will give everyone one tip. A great way to speak to any healthcare provider about cannabis is to very politely tell them you don't really care about what they think about cannabis, if they're pro or con, that what you care about is them meeting you where you're at or meeting a patient where they're at, because they need to recognize that the patient could be consuming and need education or support, and they, regardless of their stance, when you verbalize it in that way, I've had a lot of medical professionals stop, kind of pause for a moment, and then rethink how they're going to engage in the conversation, because reminding medical professionals you are there for the patient and you need to meet the patient where they're at, even if you don't agree with their choices, whether that's alcohol, heroin, or cannabis. Doctors and nurses and medical people just need that reminder once in a while, politely.
Totally. So, and the next section of the final section that, you know, kind of pertains to us in that bill is just about taxes and, you know, the tax-free sales, and how that's going to go through that department. Kind of moving through, the CCB is also tasked with defining in regulation how this program is going to work, what's going to be expected of retailers, you know, same thing they had to do with the adult use market, basically. Those are going to be things like protection of patient privacy and confidential records, enhanced training and educational requirements for employees who interact with patients. I would go so far as to say it should be everybody, not just the employees who interact with patients. I think that's valuable education for anybody working in a retail shop.
And I do think this is where the state could use a lot of feedback from you, Ed, and from other retailers on the education you've had, the education you feel you need. I just read the article by Green Mountain News today, and it quoted James, Chair Pepper, saying they needed a 3-hour education course. In my opinion, you need a lot more than 3 hours, and you need continuing education. So I think it's really important to get feedback from retailers and the bud tenders, you know, more than anybody at as to what they think they need and what they want and what that might look like. You know, is that all just recordings people watch so that can watch it again and again? Do they need the face-to-face? Do they want to be able to have a conversation with the educators or not? You know, how do they feel about an app being part of their norm? Because that is something the state of Vermont is looking at as a support mechanism for bud tenders working with patients. So I really am excited and hopeful for bud tenders and retailers to speak out as to what they need so we can make sure the patients are then getting what they need.
Yeah, absolutely.
Yeah, I would say, you know, yes to all those things, especially if it's going to be continued education, which it should be. You know, all of those methods of educating are valuable and should be explored for sure. So I think that, you know, our bud tenders would want to have refreshing stuff on online that they can, you know, keep their knowledge up. They'd also want to be in person and learn from, you know, professionals in the space. You know, they enjoy that just as much. So yes, I would say, you know, as they build out these roles, I think they're going to want to keep it as, you know, as as least restrictive as possible, and they just want people to be able to get into this program and use it. But I think as a retailer, you have, you know, the responsibility to maintain that education for your staff, you know, and keep it going, because just one class one time is never enough for any of these, especially with the constant new products and new, you know, information coming out about cannabinoids and new research and all that. So I think if you're a retailer that's not having continued ed already, you know, you should be. So whether they make that mandatory for the program or not, you know, I think the customers will know the stores that they feel most comfortable at, for sure.
Yeah, totally. Some more regulations that they need to define. how you're going to segregate cannabis products that are otherwise prohibited for sale to non-medical customers. So basically the way you're going to split your medical products from your adult use products, really what that is like high potency and specialty products are going to go in one section, I'm assuming. And then the rest of your regular adult use stock will be in a separate part of the store.
Yeah, definitely doable. You know, I think for what's on the sales floor and available to the customers, that's easy. You know, you put a case, you know, that's just got the medical stuff in it and it stays locked only for when there's a med patient there to buy it. I think that's easy. Storage, you know, whether it's just a separate, you know, locking safe inside your already safe, you know, I think you're going to want to keep it separate anyway, because just for, you know, right now as a rec store and inventory tracking, we keep, you know, every single SKU separate, and you know, we don't want them to get mixed up and stuff like that. So we're already doing that type of stuff. But for the specific medical products being, you know, separate, that's going to be guidance. You know, how you know, how hard are they going to go on that? Are they going to want us to lock it up in a separate safe every night and keep it separate completely at all times? Or, you know, they're going to allow the, you know, the products to be intermingled but just be off limits, you know, to people that can't buy them, you know, have whatever a sign next to them or something, you know, could be as easy as that. So we don't know. But you know, I know that a lot of the retailers that are involved with Vermont Growers Association, we have a retailer working group, and you know, we're having these conversations with the chair and giving our suggestions and having public comments about it and stuff. So don't know what we're going to see, but we're ready, you know, for sure.
Yeah, the other requirements are just, you know, things we've already touched on: record keeping, which you just touched on, delivery, you know, access for patients under 21 years of age, because we are going to start seeing, you know, minors, children who have various health conditions that are used to treat or cannabis is used to treat. Whether or not they come into the store physically or if it's their caregiver, is probably going to be a toss up. But I imagine they're going to have to reopen Rule 2 for this as well, because there are already pre-existing adult use regulations around people under the age of 21. Is there an exemption for people under the age of 21 with a medical card for adult use stores? No.
No.
Okay.
No. Yeah, that would be tough as a store that, you know, only has one room. Like if you only have one section of your store and you don't have multiple rooms to it, that would be tough, because you know, you're going to have underage people on your recreational cannabis floor technically.
Yeah.
You know, so.
But everybody underage has a caregiver, so likely it's the caregiver that's doing that in the first place.
My thought is, you know, that 18 to 21 crowd, who probably, or not probably, but who might not have a caregiver. I didn't have a caregiver when I was 19, you know, I was just going right to CBD. You know, so I think there is
We've seen few, you know.
Yeah.
I'd say we've had people that call and ask, you know, or people that come in and try, and it sucks because, you know, you're denying that person medicine.
Yeah.
Yeah.
Yeah. But that's kind of the basic overview of what this MUE is going to look like. I would love to hear from some of the people who are attending with us. If you have questions, I did see that Liz asked a great question about reciprocity, which is if Vermont will accept medical cards from other states. The answer is no, not right now. We've brought it up, I think, every year for the last 3 or 4 years now. Amy, do you want to talk about, like, from a manufacturer perspective, what putting these higher dose products into the adult use market would look like?
Yeah, absolutely. It would not be difficult because the higher dose products, you're not going to have as large a selection of them. It's going to be it's going to be smaller, more curated, but it will enable people myself, a medical patient, a 5 milligram dosage, I would go through a couple of packages to be able to get what I needed on a daily basis. So custom formulations of much higher doses that are going to last people for a month, etc. That absolutely makes sense. And formulation wise, it's not difficult to do. It won't take up a lot of shelf space. And to be honest with you, it's going to use a lot less packaging, a lot less energy. So overall, it will be a much more efficient manufacturing business to do the higher dose edibles and tinctures. It would not be difficult at all. And Eddie's idea of a small locked, refrigerated or cabinet unit that should hold more than enough
Yeah.
for the medical patients that come in, probably for a good month or better. So I see it as incredibly viable. I'd really like to see this happen in every dispensary, if at all possible.
Yeah. Yeah. And when we talk about high potency products, we often talk about a much higher price point, at least in the traditional market. The concentrates that we see on the adult use market that hover around 60% would be much differently priced in the black market than, say, a concentrate that hovers around like 80, 85. So how do we, aside from tax-free, keep those products affordable for a patient when we do things like increase the potency?
Easy, very
Easy.
easily. And that has been the backbone of my company, which is to put out the highest quality product at the lowest possible price, so there's accessibility, so people can get their hands on it. So when you're talking about a product that's going to retail for maybe $75 or $100, that's up there for sure. The issue is that the profit margin on an individual unit is high enough that you don't need to get the traditional margins on it to make it profitable. So it's absolutely viable, probably more viable than our traditional market.
That's great to hear. Does anybody else have questions?
I was just typing in the comments. I believe cancer, if not medical overall, is the #1 reason Americans go into bankruptcy. So oftentimes when people need cannabis for serious conditions, they are already financially distraught, or in a lower socioeconomic position that just makes cannabis unattainable. I would say I hear more often than not, I can't afford cannabis, but I can afford my prescription.
Yeah. Yeah, it's terrible. We are, like I said, in a kind of working group with the CCB, as well as a couple other named organizations, to come up with some recommendations for the Cannabis Control Board and the medical program specifically moving forward. Like I kind of touched on earlier, one of our biggest recommendations right now is to kind of re-establish some sort of oversight panel for the medical program. We've proposed an 11-person panel consisting of patients, caregivers, healthcare providers from all different sections of healthcare. We've got naturopaths, nurse practitioners, so on and so forth, as well as MDs. This sort of panel would also include an MUE retailer, as we've proposed it, and they would kind of help oversee this whole program. What are some things that you would want to see from a body like that in terms of like their ability to help sort of regulate and administer to this program? So something we've talked about, like one of their duties would be sort of helping to come up with this education plan or resources and making resources available to retailers to give out to their bud tenders. Like, what are things that you often find that you're missing from like these regulatory bodies when you find that you need assistance?
I need people like Amy to have affordable lab testing so she can make the products affordable, because that tends to be one of the most expensive parts of putting products out there, especially smaller batch specialty products. And a lot of times we don't see terpene testing because of the expense. So if the state could help subsidize that somehow. And remember, we're making a lot of money off adult use right now, tax wise, more than we are alcohol. So if we could put some of that money in use for patients and the manufacturers and retailers who are supporting them, I think affordability is going to be one that I'd like to see and push for.
Jessie Lynn, have we had a discussion with the Cannabis Control Board about retailers not jacking the prices on things for customers? Because as a manufacturer, one of the biggest points that is a problem for me is I put out a product with an accessible price and they jack it for maximum profitability, with the exclusion of Winooski Organics, of course, and a few other ones out there. But in general, that's their MO. Their maximum profitability. So when it comes to the medical products, have they discussed whether or not they're going to put any limitations on retail pricing?
I
So,
think very briefly, Amy, because you brought it up, and thank you for bringing that up in the past as well. And I think we need to keep remembering to bring that up. That is a really important thing that we need to be discussing and hopefully including in this. And I'm pretty sure, Amelia, correct me if I'm wrong, Amy was the first one to bring that to our attention for us to say, wait a minute, that is something we need to address.
So Amy was really helpful when we started talking about coming up with some sort of fixed wholesale pricing structure for cannabis based off of a percentage of a wholesale pricing structure in the adult use market. Now that's not like perfect, and it was just kind of our starting point. But the idea behind it is finding a point at which medical designated products can be sold that can't be jacked up past a certain percentage. Because you're right, Amy, you know, at the end of the day, a retailer chooses what they sell their product for. And that's just the way that the market works. But when we're dealing in something that is somebody's medicine and it's been designated as this special thing that they need, I think that we do need to start looking into ethically what is okay, what is okay to charge people for these things. Because as we, like I said earlier, venture into these higher potency products that traditionally are much more valuable on the black market, things that are more valuable on the black market are still more valuable in the adult use market. We see it all the time with like higher potency flower, or, you know, nano gummies versus like regular gummies, things like that. So finding a way to keep all of that down specifically for the medical patients is going to be really, really important. Myra
Yeah.
says create an MSRP agreement with your buyers to keep pricing stable. I think that's a really good suggestion.
It doesn't work, unfortunately.
No?
No, they have control over everything. So if you say to them, you know, please don't more than double the price of this product, they'll say, okay, we won't carry your products. And that's how it's been rolling. So they have full control at this point. They're the gatekeepers.
And the other thing I think we also need to consider as we move forward with this is the accessibility and consistency of products, because that is one thing the medical program has been able to do for years because of having integrated licenses. They are able to grow one strain and produce one product that's the same for years and years, consistent for patients. So I do think we are going to have to figure out how to balance that when someone buys a tincture and it works really well for them, and then the cultivator is growing a different strain because maybe that's what the flower market wants right now. So I do think we're going to have to play around a little bit, you know, as far as that consistency and making those products regularly available.
Yeah. All right, well, we're coming up on the last few minutes here. If anybody attending has any questions, please feel free to either raise your hand. Would also love to hear people's experiences. So if you're a bud tender or a retailer or somebody who's, you know, considering shopping at one of these places as a patient, would love to hear your thoughts or your suggestions on how we can improve this, because we compile suggestions all the time on various things to give to the CCB. And when those things are also given input by the community, they're just so much better.
And we don't know everything. Like Amy, you've brought in things to our attention as a manufacturer. We're not manufacturers, so it's so helpful and important to have everybody's voices, and we really appreciate them. It's off also the day after the election and evening time. So
I
we
know.
understand everyone not jumping in too, and you can always feel free to reach out to us individually, shoot
Yeah.
us emails, any of us on the call will all kind of communicate. And I always tell people too, there's a lot of different ways to advocate. So if you want to advocate, ask us, we'll help you, whether we do it with you or for you because you want to be anonymous or you just need a little bit of support. Or who do you send your email to? Please let us know how we can help you guys all be advocates because it really takes us all together to make this change.
Definitely. Yeah. All right. Well, thank you, everybody. Yeah, thank you for coming. Have a nice night, everyone.
Awesome discussion.
Good night, y'all.